Good morning to everyone. I am Dr.Helan Rathi from Emmanuel Arasal JJ College of Engineering. Now we will learn about clinical applications of the Doppler effect. First of all, we should know what is called Doppler effect. The Doppler effect is the change in the frequency or equivalently the period of a wave in relation to an observer who is moving relative to the source of the wave. The Doppler effect was studied by Christian Doppler in 1842. A common example of Doppler shift is the change of pitch heard when a vehicle approaches and recedes from an observer. Compared to the emitted sound, the received sound has a higher pitch during the approach, identical at the instant of passing by, and lower pitch during the recession. When the source of the sound wave is moving towards the observer, each successive cycle of the wave is emitted from a position closer to the observer than the previous cycle. Hence, from the observer's perspective, the period or time between cycles is reduced, meaning the frequency is increased. The Doppler effect is also known as Doppler shift, that is the apparent change in frequency of a wave in relation to an observer moving relative to the wave source. The Doppler effect applies to echoes from moving reflectors such as red blood cells as well as to waves radiated from moving sources. The Doppler equation is given by Fd is equal to 2V F naught cos theta d divided by C. F naught is the frequency of the incident wave. V is the speed of the reflector. Theta d is the Doppler angle between the direction of motion and a ray pointed from the reflector to the receiver. Now we are going to applications of Doppler effect. What are the clinical applications of Doppler effect? There are three applications. One is echocardiogram and heart function. Second one, Doppler sonography. And third one, health of fetus. Echocardiogram, that is ECG, and heart function. An echocardiogram is an example of Doppler ultrasound. It can be used to create images of cardiovascular system and to measure blood flow and cardiac tissue movement at specific points. A Doppler ultrasound can assess the function and state of cardiac valve area and any abnormalities in the heart, blood leaking from valves, and it can show how well the heart pumps out blood. Doppler sonography. Doppler sonography is the practice of using reflected waves to see how blood flows through a blood vessel. It helps doctors measure the velocity of blood through major arteries and veins such as those of arms, legs and neck. The Doppler sonography is a non-invasive test. It estimates the blood flow by bouncing high frequency sound waves of circulating red blood cells. A regular ultrasound uses high frequency sound waves to produce images of anatomical regions of the body but does not measure blood flow. This method can estimate how fast blood flows by measuring the change of frequency of the reflected ultrasound. This method is a preferred method to more invasive procedures such as arteriography and venography, which involve injecting dye into blood vessels so they show up clearly on X-ray images. These are less safe as they make use of ionizing radiation and moreover do not measure velocities. Health of fetus and offspring of a human. Blood flows in the umbilical cord. That umbilical cord is Doppler through the placenta or in the heart and brain of the fetus may be checked. This test can show if the fetus is getting enough oxygen and nutrients. Doppler ultrasound may be used to guide decisions during pregnancy when the fetus is smaller than normal for its gestational age. Blood flow through the large blood vessel in the umbilical cord can be looked at. RH sensitization has occurred. Blood flow through a blood vessel in the brain can be used to monitor fetal health. The mother had problems such as preeclampsia or sickle cell disease. The Doppler effect is a cornerstone of non-invasive hemodynamics. Biomedical engineers continue to refine signal processing algorithms to reduce noise and artifacts. Some limitations are there in the Doppler effect. First of all, medium dependency. The Doppler effect is applicable only when the velocities of the source of the sound and the observer are much less than the velocity of sound. Second one, direction of motion. The motion of both source and the observer should be along the same straight line. These are the limitations of Doppler effect. Next, what are the uses of Doppler effect? Many people mistake the Doppler effect to be applicable only for sound waves. No, it works with all types of waves including light. The list of few applications of the Doppler effect is sirens, radar, astronomy, medical imaging. Already we saw the flood flow measurement, satellite communication, vibration measurement, developmental biology, audio and velocity profile measurement. These are the uses of the Doppler effect. Next class we will see about ultrasound transducer. Thank you.